Hi, I'm Dr. T, and I'm a pediatrician. On Ask Dr. T, I answer health questions from teens. Questions ranging from safe sex to self-love to questions about body parts. Let's get this episode started. This set of questions is all about birth control. And this is just going to be some general concepts or principles of birth control. We'll get into some specific forms later, but for now, general birth control questions. Question number 1. I've been having sex with my boyfriend, and I am on birth control, but I haven't been able to talk to my parents about it. They don't even know I have a boyfriend. So how do I know if we're being safe? First of all, good job being responsible about having sex. I think it's wonderful that you are aware of the consequences and you got yourself on birth control. So very good job. When it comes to having sex, a couple of things that you should consider about being responsible or protecting yourself. 1, protection against pregnancy, which it sounds like you're doing, and that's fantastic. 2, protection against sexually transmitted infections. And that includes a barrier method, like a condom, as well as regular testing. So it's recommended that any teenager who is sexually active get testing once a year. So those are the other things to consider when it comes to being safe. Making sure that you're taking your birth control as prescribed is very important, but I would talk to your prescriber and make sure that you are doing it correctly, and if you have any questions, you can certainly talk to them about it. But good job being responsible. The thing to remember about birth control and sexually transmitted infections: if you talk to your doctor, that information should remain confidential. So your parents don't necessarily need to know when you talk to your doctor about these issues. I would encourage you to talk to your doctor just to make sure that everything is as you are planning. But good job. Second question: is it necessary to be on birth control if I'm only participating in oral sex and mutual masturbation? So, no. So oral sex and mutual masturbation do not carry any risk of pregnancy, making sure that no semen gets in the area of the vagina. So as long as you're washing your hands between activities, then there wouldn't necessarily be any reason for birth control. So you're doing a good job. Question number 3. Why does my birth control still make me sick every morning? So some of the major side effects of birth control are going to be nausea, headaches, breast tenderness, and some unpredictable spotting, which we'll talk about in a minute. But nausea. So all of those symptoms really should resolve within the first couple of months or so with using birth control. So if you're still experiencing nausea and vomiting because of your nausea months into your birth control, I would talk to your doctor about potentially changing the hormones or switching to a lower dose because it sounds like that might be too big of a dose for you. Or there are medicines that you can take for nausea. One other thing that you could potentially try would be taking the pills at night so that you go to bed and you don't feel those feelings, or make sure you're taking those pills with food. So a couple of different things you can try if you haven't already. If you have tried them, talk to your doctor about changing the form and or the dose of your birth control. Question number 4. Is it normal to spot while on birth control? Now this is the issue of breakthrough bleeding when you are starting a new form of birth control. That is common, and that is because you are exposing your body to some new hormones, and your body can be a little bit out of whack for a while. Now there's less of a chance for breakthrough bleeding when you start your birth control right after you finish your period. So kind of finish your period and start fresh with birth control pills or a depot shot or Nexplanon. So there would be less of a risk, but still some risk for spotting. So in general, you can potentially expect some spotting during the first couple of months of starting a birth control pill, although that should get better with time. Usually within the first couple of shots of depot, although that should also get better with time. and then the implant, usually the spotting should resolve within a week or so. If it's going longer than that, talk to your doctor. But you can expect some spotting initially, but that should get better for sure. Last question, is it safe to vape and take birth control? Yes and no. So vaping will not reduce the efficacy of your birth control. So in that sense, you're safe and protecting yourself from pregnancy. But vaping is not healthy. So be careful. There have been actually some situations recently where young people who are vaping, and it depends on the substance that you're using, but that vaping can cause some severe lung damage. So be careful with vaping. The other thing is that it is not a benign activity. And I know we're talking about birth control, but vaping can deliver extremely high amounts of toxins to your lungs. So be cautious with the vaping, but it's not going to reduce the efficacy of your birth control. And that'll do it for this round of birth control questions. And remember, if you have a question for Ask Dr. T, you can either respond in this video or submit through my website, askdrt.net.